We first came to Coeur d'Alene in 1961 after college graduation. It's really nice to know that Kootenai is here for us. We've made good use of it. 3 babies were born at Kootenai Memorial. My husband's had 2 back operations. Lynn was hit by a car and badly injured, and Corey, my son-in-law, in his heart, and then my back operations. I've had 2 surgeries this year on my back. Dr. Larson's my doctor, and he's a miracle worker. He consulted all his colleagues that he knew did this kind of surgery. Then he practiced on a cadaver. He studied and finally figured out all the gear he was going to put in, and I could walk right away. It was great. I felt so good after that one, and I could get out of bed and walk, and I went to rehab for a week and went home, and I've been good ever since. They couldn't be nicer. They're so helpful and caring, and I just couldn't be in a better place. It's been a success every time. They've taken such great care of us. When Lynn had her triplets, it was Thanksgiving Day, and she had been in the hospital in Spokane because they couldn't handle triplets here.
We kept trying to have a baby and did Clomid and then in vitro 2 or 3 times. And then between there, we got pregnant and lost that baby. But then we made up for it. Yep. We left the doctor's office in Spokane and they had told us there's 3 babies.
3 heartbeats.
3 heartbeats. So actually the pregnancy went really well until about, I had to go on bed rest at 24 weeks. We had to rush in the middle of the night to Sacred Heart because the babies were too young to be born in Coeur d'Alene. And they didn't have a NICU that could support babies under a certain age. They stopped the labor, and I ended up staying there for 6 weeks. The babies were born at 29 weeks. I made the decision to go back to work because I didn't want to lose my maternity leave while the kids were in the hospital, because I wanted to be home with them when they came home. I would get up early in the morning, get to work, leave at 4, had to drive to Spokane in the middle of the winter, and then stay there till 9, come home, just every day. And we did that for 52 days.
I was going to Sandpoint every day to work and then coming home and driving to Sacred Heart to be with her. And I was like, gosh, I don't even want to do this drive again. But you have to, because you want to go see your kids, you want to see your wife. And then once the boys were in the NICU and we'd both come home, and it was tough because it was draining. And you didn't know if they were going to be okay, and you worried about them.
One of the boys came home first, and then so I had him, and you couldn't go see the other babies because you can't take the one baby you have back into the NICU because they were afraid of RSV virus and all that kind of stuff. So we had to drive over there, find someone to watch a brand new baby that you just brought home. And then the second one came home, and Ian I couldn't go see the whole time. He was there last. I had 2 babies at home. I couldn't go see him, so it was really hard. It's hard to describe how you felt because you just felt like there was nothing you could do. we'd have had a NICU here that could handle the situation, I mean, it would have been 2 months worth of 2 hours a day more with the kids. It's very exciting, I think, to be able to have the facility there so people can be close. It's much safer to be close, I think. I think it'll save babies' lives and allow babies to be around their families, too. Grandparents can go see them, brothers and sisters. It went from where I was born, Kootenai Memorial, to Kootenai Medical, to Kootenai Health, and I think it means great things for North Idaho.